Hey, have you ever heard of scoliosis? So let me explain what is scoliosis. Scoliosis is a condition where your spine curves sideways, forming an S or C shape. Most people think it only happens to kids or teens, but that is not true. It can also happen in adults. Poor sitting posture, especially when you're sitting for long hours, can slowly shift your spine out of place even as an adult. The poor sitting posture might be doing more damage than you think. Is this you when you are studying or walking? Have you ever caught yourself crossing one leg over the others? You are not alone. But did you know that poor sitting posture can lead to more than just back pain? In some cases, it can worsen or even contribute to a spinal condition called scoliosis. When we cross one leg over the others, the pelvis tilts laterally, one ilium shifts higher than the other, creating the pelvic misalignment. To maintain the balance, the lumbar spine compensates with lateral flexion and slight rotation to cause the curving the trunk. This will cause asymmetrical spinal curve. Have you ever sitting like this? Posture of sitting sideways also leads to misalignment. The pelvis shifts sideways to support more weight than the others. The lumbar spine laterally flexes toward the supporting hand. Over time, this uneven distribution of forces can cause or worsen functional scoliosis. So how to detect it? Scoliosis can be detected through simple visual checks. When observing a person from behind, signs of scoliosis may include uneven shoulder or hips that appear unbalanced. The person may also have a waist that looks uneven or a body that leans slightly to one side. During the test, the person bends forward at the waist with their arms hanging loosely. If one side of the back appears higher than the other, it could indicate a spinal curve. If you notice any of the symptoms mentioned above, it is important to seek professional help. A doctor may recommend an X-ray to determine the severity of scoliosis and measure the exact degree of spinal curve. A curve greater than 10 degrees is considered scoliosis. Treatment for scoliosis depends on the severity of the curve and the patient's age. For mild to moderate cases, wearing a brace can help to prevent the spinal curve from worsening. The brace does not correct scoliosis permanently, but it helps to control the progression while the body is still developing. In addition to bracing, strengthening the back muscle through targeted exercise or physical therapy, engaging in regular back strengthening exercise such as hanging from a horizontal bar, swimming, or doing the plank can improve the muscular support around the spine. In severe cases, when the curve is greater than 40 to 50 degrees or continue to worsen, surgery may be recommended. To alleviate scoliosis, we should maintain a proper and upright sitting posture. To sit correctly, your feet should rest flat on the floor. Also can put a pillow at your back to support your lower spine. The effects of scoliosis are different. In mild cases, it may just cause stiffness or fatigue, but if the curve worsens, it can lead to muscle imbalance, back or neck pain, leg length discrepancy, and difficulty with breathing if the curve affects the ribs. So it is the time to take action to prevent further complications by having a good sitting posture.